Hi everyone, Amy Robach here with Dr. Kristi Funk. She has been such an incredible wellspring of information for all of us who are in menopause. Mine is chemically induced. After becoming a breast cancer patient, I went through chemo and stopped menstruating, and then after that my doctors put me on tamoxifen, which keeps me in a state of menopause. So I have been
fun times
dealing with that, and it's not something you think about when you're young. I just never anticipated it, and even when I was going through the cancer treatments, it wasn't anything I was thinking about being down the road for me, or even immediately.
Well, you're just in the throes of, I don't want to die, and whatever it takes, bring it on.
Right.
But now you didn't die, and what it took needs some reassessment. You need to know how to live with this so that your life is still joyful. And right now you're so youthful that no one expects things to be dry everywhere, and the mood swings and hot flashes, night sweats, insomnia, it really affects relationships and your parenting and your work.
How do you feel about yourself? I mean, I really felt like I went from being 39 one day to being 60 the next, and it was so overwhelming, and you can get incredibly depressed thinking about it, especially when your friends, your peers who are your very same age are having babies.
Right.
And it just feels so strange to be in a completely different part of your life than the people who are your peers.
Yeah. It's like that movie Big where Tom Hanks, he goes to bed at like 10 years old and he wakes up at 30. He's like, what happened to the growing up part? Wasn't I supposed to ease on into this menopause thing?
Right.
So yeah, it can be shocking and upsetting. And for those who really need to shy away from estrogen or hormone replacement therapy, there are very few alternatives that truly work. In human trials randomized against placebo, ultimately, the majority of them kind of show a wash.
Yeah, I mean, look, I put collagen in my coffee in the morning, and I take hyaluronic acid pills, like in the hopes that I can hydrate my skin and keep my bones strong. But I don't know. And the nutrition part of it, obviously, I've completely changed. But I'm trying to do what I can do to battle the effects of menopause. But it is a losing game.
Oh, well, we needed to stabilize. We don't want the loss to continue downhill, and that's where I think we can come in and change things. So you're already doing things really well, but a lot of women don't know that just daily routine exercise, quit smoking if you smoke, eat tons of high fiber, low fat, high protein foods. So what does that look like? That's a ton of fruits and vegetables with the veggies. I love the cruciferous berries and broccoli for your fiber. And then when it comes to protein, because animal fat and animal meat has so much fat, and so does cheese. So animal products you can have it in small quantities, but really you want to look at soy, beans, peas, nuts, lentils, these high fiber and high protein sources that come from plants. That's the safest way, because in menopause, no surprise to anybody, weight gain happens because your metabolism slows, but heart disease starts to skyrocket. You also are at risk for osteoporosis because it was the estrogen in your body and blood that was keeping your bones strong, so you're at risk for bone breaks and having osteoporosis. So you need calcium. If you're not getting enough in your leafy greens, I want you having 1,200 milligrams of calcium, and vitamin D 2,000 units daily.
Yep. I mean, I am doing all of that. It's so important because you are where you eat, actually. My mom used to always say that to me, but I have cut all sugar out of my life, and I have seen a huge difference in just how I feel, my energy, how I look. Everything's changed because of it. And so you have to make adaptations to bring in all those healthy fats, healthy proteins to compensate for all those loss of carbs.
Right. But all the studies out there really looking at food, and I've scoured the earth looking for something that's non-estrogenic that really helps stave off all of the crazy. And as much as soy can help, it's isolated. It's like 4 hot flashes. But across the board, there is this herbal blend that is a real miracle for menopause that took me 16 years to find. And they did 3 human trials against placebo, randomized, controlled, double blind, and as they followed these women out over 6 months, all 12 major symptoms, including hot flashes and vaginal dryness, decreased libido, pain with intercourse, hair thinning, wrinkly skin, it all got better in 96% of people.
That's incredible. Sign me up.
I will.
You're sending some to me, right? So tell everybody what the herbal blend is.
You can get it at pinklotus.com. It's called Menopause Miracle.
Okay, well that pretty much
it's a
says it all.
miracle.
Right? Do we have any questions, Tony?
We have a couple actually. Joe, she wants to ask, these hot flashes and night sweats and sleepless nights are getting terrible. What can I do for it all?
Yes, so I think we addressed, you can do some food sources like the soy products, edamame tofu, but really Menopause Miracle works like a charm. And over-the-counter, easily found evening primrose oil in combination with vitamin E has some effect.
Patricia, how risky is hormone therapy?
Ooh, great question. So, Patricia, it always comes down to an individual balance when you're talking HRT. Like, what are your risk factors for getting breast cancer, endometrial cancer, blood clot, stroke, and heart attack? Because these are all associated with a little spike when you're on hormone replacement therapy. And you also want to look at why you want to be on it. Like, if you're hot flashing your way to a divorce, well, okay, let's first back up and try some of these other non-estrogen remedies.
Don't you think most people, I mean, I don't know, maybe I have a misconception, want to do it because they don't want to look old and they don't want to feel old. And that's what it basically boils down to. But you do have to worry about the risk. I mean, obviously, if you're a cancer survivor, it's off the table.
Right. It is true. We're always in pursuit of that fountain of youth. And I don't think we're going to change that strong desire within all of us to maintain that youthfulness. And estrogens really do it better than anything else. But they have risk.
Yeah.
Sorry, I just had this one good question.
Gotta have it.
I lost it here. Here we go. From Angie. When does it start if you had a hysterectomy but kept the ovaries?
Oh, it starts the same natural time it would have started if you kept your uterus inside of you. So national average is 51 years old.
And that's actually younger than I thought, by the way. I thought it would have been 61.
Oh, really?
So I didn't realize it started at 51. For most women, that's the average.
Actual menopause. So the perimenopause with the weird periods and stuff is late 40s. It can be as early as your 30s. The peri period on average lasts 4 years, but it can be just a few weeks to 10 years.
I think that's so important for women to know because I have, as I just mentioned, so many friends who waited later in life to have children.
Right, I was 40.
You were 40. So okay, so and I actually, when I found my cancer, I was actually trying to have a child with, it's a second marriage for me, my second husband. We wanted to have a baby together. I already had children, so it wasn't this big catastrophe, but it still was a huge loss because we were actually trying. And I remember my oncologist saying, thank God you didn't get pregnant because hormones associated with pregnancy aren't good for breast cancer.
Exactly.
But I think for women who think they can wait until their late 30s or their early 40s to have children, don't realize that for some women it becomes impossible because of early menopause.
Right. And that's a loss that leaves a real hole in your heart because you didn't choose it.
No.
And
you feel
permanent.
powerless.
You can't reverse it.
You can't reverse it.
Right.
I remember that moment. There was a moment where when my oncologist said to me, like, you are out of the baby making business, and you know it's not negotiable. And I remember she said I had a couple weeks to decide if I wanted to harvest eggs, find a surrogate, all of this stuff, and I just was so overwhelmed with the cancer, it just wasn't even a consideration. But my mom, who was 60. Who just told me quickly, I'll be your surrogate. I was like, Mom, are you kidding me? Like, stop. She raced to the rescue. I was like, Mom, I'm not. She's like, oh, you did a story about it. It's possible. I'm like, it's possible, but we're not doing that, Mom. We're not doing that. She wanted to help so badly, but because she could still have children. It was just this weird thing. My mother would have been capable to have had a child.
Well, that's why menopause is 61.
Right. I think my mom was later, and so I was like, my mom can have a baby, but I can't. What is happening right now?
Oh no.
But that is something that people need to consider, just because is there a way to know if you're a candidate for early menopause? I mean, I know you can't anticipate cancer, but what about the genetic part of it?
Genetically, you tend to go through menopause at the age that your mother went through it. And the way to know would be to be checking your estrogen, progesterone, LH, FSH, these hormone levels within your body every time you go to the gynecologist if you really want to know.
Okay, that's good to know. All right. Any more questions, Tony?
Let's do one more.
Okay.
This one's from Krista. I saw the mention of soy milk. What about soy and the estrogen in it? Do you have to be careful about too much soy?
Ooh, Krista, no, you do not. So here's the deal with soy. You have two estrogen receptors in your body, alpha and beta. Alpha sitting on cancer cells. So when the plant-based phytoestrogen when your own estrogen hits alpha, it's going to send a cancer signal to multiply and divide. When soy milk or other phytoestrogens, edamame tofu, hit your body, they prefer with 1,600% more interest the beta receptor. When it hits beta, it does two interesting things. It shuts alpha down and it goes out into your bloodstream and inhibits an enzyme called aromatase that takes testosterone, which your adrenal gland is pumping out, and makes it into estrogen, and it inactivates aromatase. So it makes you have less estrogen circulating and it stops this alpha receptor. If soy estrogens hit alpha, It has the signaling capacity of 1/10 to 1/100th of estrogen, so it's just like a whisper. It's basically tamoxifen. It's sitting in there, but like, sorry, estrogen, I'm blocking it. So
That's
actually,
so interesting.
the cancer literature in soy in breast cancer patients on tamoxifen shows that those who consume soy versus those who don't have 60% less recurrence, 29% less death.
Wow.
Soy
All right,
it
I
up.
will be soying it up.
Yeah.
All right, thanks everybody.